Welcome back. Gundersen Lutheran created the Global Partners Program in 2008. The program develops long-term, sustainable relationships that expand beyond our typical borders. Their hope is to improve overall health of the region, educate people, and improve the quality of life for people and communities, some communities not too far from us. And joining us this morning to explain more about the efforts of this partnership is Gundersen Lutheran's Rose Netzer. Good morning, Rose. Rose,
Good morning, Julie.
Just start off by telling us, how does Gundersen Lutheran decide which areas to focus on, and what are some of those areas?
Well, we started in 2008 by doing a survey of the medical providers here at Gundersen, and they really chose Africa, Central America, and right here in our own country. After that, we reviewed the areas and tried to identify places that really had a kind of met with our own capabilities. And from that, we chose Tanzania in East Africa and Nicaragua in Central America and the Pine Ridge Indian Reservation here in South Dakota.
What are some challenges that that team of doctors face, when they go over to that area?
Interestingly, the challenges for all three areas can be very similar. Lack of resources. You will find in Tanzania, Nicaragua, and on the Pine Ridge, people who are very, very willing to work with us, people who want to grow their communities, people who want to get to know who we are and support our community efforts. But what you don't find are medications that treat the illnesses that are prevalent. I remember our first day working on Pine Ridge, and I think it was Dr. Robert Witt saw a patient and said, we would normally just send this patient up for a CAT scan, but the CAT scan on the reservation wasn't working that day. Those are our challenges.
How rewarding is this partnership between Gundersen Lutheran?
It's overwhelmingly rewarding. I think about this often. Teams come back and they describe the experience as life-changing. We have had a team go to Pine Ridge monthly now since last October. We sent our first teams to Tanzania and Nicaragua in March. And to a person, they came back wanting to return, having wonderful ideas on how the work we're doing can both support our work here in La Crosse and support the healthcare in these communities.
Thanks so much for joining us this morning, Rose. We appreciate your time and the efforts of Gundersen Lutheran.
Thank you very much for having me.
Thanks.